Welcome to the Velocity Made Good podcast. I'm your host, Ted Grisella. Today's guest is Dr. Babatunde Adeagbo, an associate professor in the Department of Pharmaceutical Chemistry at Obafemi Awolowo University in Nigeria. Welcome, Babatunde.
Say good day. It's nice coming to this program. I'm delighted to come for this interview.
Okay, great. You were one of the scientists who received the travel grant to attend the American Society of Clinical Pharmacology and Therapeutics meeting in Washington, D.C. And I want to ask you about your experiences there. But before we get to that, can you tell us about your background and a little bit about your current position?
Thank you, Ted. As I mentioned, and I'm associate professor in the Faculty of Pharmacy, Obafemi Awolowo University. I have my background in pharmacy, my degree in pharmacy with the distinction in year 2001, my master's in pharmaceutical chemistry in year 2008, and I have my PhD in pharmaceutical chemistry 2014. So my background is majorly into pharmacokinetics, pharmacometrics, and integrating into with pharmacogenetics, and majorly into clinical pharmacology. And my journey into clinical pharmacology actually started during my master's program. In my master's program, basically what I went to is pharmaceutical analysis, looking at the quality of drugs. So along the line, my university had got a grant to Carnegie to establish therapy drug monitoring program. Along that time, imatinib was introduced for treatment of chronic myeloid leukemia in Nigeria, and the only center for management was my teaching hospital. So the patient started taking imatinib for management of chronic myeloid leukemia. And unfortunately, some of the patients were not responding well. So my sponsor was approached by the clinician to look into why are we not having a good clinical outcome compared with the other populations. So they came up with that we need to look at do therapy drug monitoring, and based on my skill in instrumentation for an HPLC, I was called upon to start development of the method for the bioanalysis of imatinib. So along the line, it came up that we need to do the pharmacokinetics of imatinib in Nigeria, but there's no information in Africans at that time. So along the line, so the only tool that we can use at that moment is population pharmacokinetics. Unfortunately, there's no skill, and there's no experts around us at that moment. So one of the anomalies of our faculty, Dr. Kayode Ogumero, who is working in the University of Manchester, was approached. So it got me connected with Uppsala's pharmacometrics school through Novartis travel grants. So I have to go for advanced pharmacometric course in Uppsala. So that's why my journey started. I was linked to Professor Connie Pillai. So my journey started into pharmacometrics, training in NOMEM. And through Professor Connie Pillai, I was connected with African pharmacometrics and started growing my areas. And that's how I was able to succeed during my PhD program. So actually, it's the need that draws me into clinical pharmacology, because there is a need to bridge to really solve the problem why the patient are not responding well to the drug at that moment. And that's one of the main challenge that during the clinical trials, the Africans were not put into consideration. So we have to start now looking at the population pharmacokinetics of imatinib, and through my PhD, I'm able to get some data and also link it to pharmacogenetics. And the pharmacogenetics of the drug is very complex. And looking at the diversity of our population in Africa and in Nigeria. So that created a platform for me to really have different skills. Skills from pharmaceutical analysis to bioanalysis, from bioanalysis to pharmacometrics, from pharmacometrics to pharmacogenetics, and now to integrate them and moving forward. When I completed mine, I got an opportunity by WHO, TDR, to have a clinical experience and to be attached to an institute in the United States, and that's the Infectious Disease Research Institute, known as Advanced Access to Drug Institute in Seattle. So that also exposed me to clinical trials, another opportunity in vaccine development, and that bring me also into another area, and that is thermostability of vaccine. So throughout that 1 year, I was involved in development of projects on thermostability of vaccine, and I learned a lot also into vaccinology, and that really encouraged me. And that gave me an opportunity again from EDCTP to go. I got another grant by EDCTP to really to look at thermostability and chemical conjugation of vaccine to the protein that is being worked on. And through that opportunity, I was able to make um, a kind of an impact, and that has encouraged me into the area of clinical pharmacology. Thank you.
This problem of surprises when drugs are introduced into a new country in Africa because of the lack of data on patients in those countries is a recurring theme of people that I talk to. So it's interesting that you were able to follow up on a of clinical failure with the drug and try to investigate the reasons for the poor outcomes.
Yes, it's one of the in that area. It's helping open up, telling us that the diversity within African population, and because of that diversity, the response to drugs will differ from other populations. Let me use the example of imatinib for you. We actually find that there's interpopulation variability with imatinib use, and also within our population, there is wide inter-individual variation. So, in actually, that's us to really have a change of mind to really know that during clinical trials, the tools of our ometrics will be of the use in really studying different and diversity of population so that all those things will be put into consideration in drug development.
So you were able to attend the ASCPT annual meeting in Washington, and I was wondering how you found that meeting, and is it helpful to you? Was it helpful to you in thinking about your research and different ways of being able to approach this problem that you have of identifying characteristics of patients in Nigeria?
Yes, it was a wonderful experience because I met so much. I was able to interact with many people during the program, and there are different sections. I attended different sections during the program. I have about three takeaways from that meeting: the use of technology, leveraging on artificial intelligence, learning machine, and also integrating it into clinical decision. These are the areas that are still lacking in Africa. As a clinical pharmacologist, I'm thinking on it, working on it, meditation on it, that we need to make use of these newer technologies and methodologies to really improve the clinical outcomes of some of the drugs are available to us in Africa. And beyond that, that is an advocacy within Africa for bioequivalent studies. And I see, and with in Nigeria, there's emerging need for bioequivalent studies that should be done within the country itself. And what I learned from the ASPT was using this tool actually to really work out for us to be part of those bioequivalent studies and to make sure that we are actually there when we're integrating all our skills to make it relevant and to really to implement it within our population. So actually the focus of the last conference was actually my need. It's a passion that made the news. So all the sessions were beneficial, especially the post-conference session, which I have to attend. And I found it so useful, so much documented and brainstorming on it that because we majorly on the new technologies and new methodologies that actually others are implementing, and there's a need for us to integrate it in our not just into research, also as a teacher in university to integrate into our curriculum, at least to open up the new ideas so that our students will be familiar and also could be at the same template with other students all over the world.
What do you wish that the membership of ASCPT knew about the challenges and opportunities of being a scientist in Africa?
Yes, thank you. Number one, there are great opportunities. We have the populations, we have the people. Unfortunately, also, we have the disease conditions. We have the burden of disease conditions. Unfortunately for us, also, we lack infrastructure and facility for this research. So, for me, what I'm looking forward is number one, I will need a kind of mentorship, which this program has already started, in which we are attached and we have mentors and we'll be to grow ourselves, grow the skills, and create more platform and opportunities to share ideas and to really work to make sure that we solve the problems in Africa. And by growing the field, the networks and the professionals within Africa population, that can be done through mentorship and also share infrastructure. One of the major challenge as I mentioned to you on my pathway and my journey to clinical pharmacology, is the lack of infrastructure. We're going to talk about the bioanalysis. For example, you need an SCLMS. Maintaining that kind of SCLMS within African population is a challenge. So without collaboration and shared infrastructure and interest between all the other experts within the community, it will not be possible. So, but if that can be an extension in which we can share infrastructure, we can have some of the equipment that are in other population that some to them they are not so useful. They can donate it to us, and now we can be make useful to us, and we could at least use opportunity to share into maintain those equipment, and therefore it will create capacity. It will help us to grow more and to do things that we need to do without waiting for other population to do it for us. And also, I think in shared knowledge and by creating opportunity for exchanges, share co-supervision of students, and which we can have students even based in Africa, and we can have experts to co-supervise in US, other place, and they can have a split site orientation when they still having their degree even within Africa. So that within the community, that way education will enhance our capacity and will help us to solve our problem better than just because most of the time when people go outside to be trained in other population, because they're exposed to that population, by the time they come back, there's no infrastructure for them to function within that population. But if people are trained within the population and we provide opportunity for them within that population, the migration will be limited. And when we have a real expert within the population, then the burden of disease can reduce within our population in Africa. So I believe if we can have the kind of in terms of share knowledge in which we can have exchanges, collaborations in training, and we could have opportunity that we can open up our space in which we can have teachers for us at level postgraduate studying, even ready to teach our students, even from outside. Because then through online programs, I think that will also be will help us more. Also, one of our main challenges also here is access to some of these materials that we use, reagents. I can still, even with if I have grant the opportunity, I can stay for 6 months to have access. But when I was in US for a year, if I am exhausted with my material, within 30 minutes, within hour, I get the order. And in the next 2 days, I have the material on my table, on my bench. But here, I can wait for 6 months. But if we have a kind of a shared collaboration, somebody here in US could assist us, help us, and now ship within 24 hours to Nigeria. So that kind of shared opportunity will help us, and it will help us so that we do not have delayed in fulfilling the timelines and really making the work to one thing that ASTCPT have done for me is also to open up online training webinars and skills can be changed to us, and increasing that is also important. And lastly, sometimes it's also important to bring down some face-to-face training down into us here, share workshops that we can host within our population here. That we can than just somebody just going for we just sponsor only one person to go for a conference for a workshop. But if we can get some small funding, we can create a kind of a workshop, share experiences, and most of this can also be done online, which will open the space for some of our students, and they could get those experiences, and some of the hands-on training could be done, and that we can reach more of our students than just a few people. These are just what I think could be done that could improve our training here. Thank you.
Babatunde, what are your aspirations for the future? What would you like to accomplish as you continue in your work?
Thank you. My aspiration is to become an independent of the scholar, well funded, and having a center of excellence in which I integrate all my skills together. Within the pharmacokinetics, pharmacogenetics, pharmacometrics, putting all these skills and vaccines together, and to make sure that in Africa we could solve our problem. We can bridge the gap between the clinic and the lab so that we could have clinical trials being done right here in Nigeria, right within making sure that I have the clinical every facility to make sure it's being done. And this is my long-time aspiration and passionately pursuing it so that we could at least have people on ground in Africa doing what is right in the right way and within the global community.
Those are certainly worthwhile goals. Is there anything else that you'd like to talk about that we haven't covered here today?
So actually what I want to focus and I'll say now is translating the knowledge and also opening up the space. So, and what we need much more is collaboration, and what we need more is mentoring, and what we need more is that handshake to make sure that we able to achieve this through grant opportunities, through short-time trainings, and if we could do this, and which I know the clinical pharmacology community of ASCPT are capable of doing, they've shown it through the love, through the meetings, which they are ready to pick us up in Africa and to make us what we should be.
Well, thank you very much for your time today, Babatunde. I appreciate you making the effort, and I look forward to meeting you at future ASCPT meetings.
Thank you.